One more has joined, not joined, I think. Which team? Questions will be there on the screen. One question will be there on the screen. 4 options will be given. The color code of the options will come on your mobile. What you have to do is within 30 seconds, you have to press what you think is right. The beauty of the thing is there is no negative marks. So you can, on history of medicine, cardiology, like that. So this quiz will go on for 1 hour. And at the end of 1 hour, the first 5 teams' position will be there. So relax. Even if you don't know the answer, try something because you know there are no negative marks. Try to answer faster because the team which is the computer judges on the rapidity of the answer. And all the questions are from Harrison's textbook of medicine. So standard, what is that? Physiotherapy students, please come back at 11. So, all the questions are from Harrison's textbook of medicine. So I think the KSECD team, please announce the names, madam. And
Dr. Nikhil and Dr. Sanjay, KSH01.
Not yet. Which team is that? Having problem in joining? We'll help you. I will help you. We have got the expert here. And if somebody in the audience answers, you will get some prizes. We thank Rotarian Vasant Malya who is here. He is covering the event. And it will come in all the papers. Cardiology. During ischemia of the myocardial tissue, impaired cell membrane function leads to leakage of sodium, uptake of potassium, and then increase in calcium. Next option, leakage of calcium, uptake of sodium, and increase in potassium. Third option is leakage of potassium, uptake of sodium, and increase in calcium. Fourth option is leakage of calcium, uptake of potassium, and increase in sodium. How many? Yes, 20. So we didn't have all of them. So what's the option? Option 3. Option 3 is correct. 10 of them have answered correctly. And any changes? Yes. KVG has come to top. Mullers. On the screen for you, the following image denotes a type of carotid. Okay. Denotes a type of carotid pulse seen in aortic stenosis, aortic regurgitation, hypertrophic obstructive cardiomyopathy, sepsis. This kind of a disease is caused by genetic mutations in which of the following genes? PRKAG2, LAMP2, DAZ, FXN. So on 20 have answered. No time for the audience. We'll see whether 21 will answer. No. Okay. Anybody in the audience? Yes. LAMP2. Who is it? We are getting very good answers from our interns. LAMP2, correct. 8 of them have answered correctly. And in the treatment of hypoglycemia, when is administration of subcutaneous or intramuscular glucagon preferred? Type 1 diabetes mellitus, type 2 diabetes mellitus, alcohol-induced hypoglycemia, sulfonylurea-induced hypoglycemia. Question number 12. Second question in endocrinology. Friedwald formula is used for the calculation of which of the following? Total cholesterol, triglycerides, HDL cholesterol, LDL cholesterol. Okay, anyway, the time is up. Which team had a problem of network? Hope there has been no problem. Because these are issues. So, moment anything happens, please raise your hand.
There is a problem.
Okay. So what? Thyroidism, secondary hyperparathyroidism. So 10 have answered, 11, 12. I don't know whether we'll have time for the audience. 18, 9, 20, time up. Yeah. So what's the answer? Yeah. Option. Yeah. Option B. Right. hyperphosphatemia. Now, contraindicated for use in patients with family or personal history of medullary thyroid cancer or MEN. So, the drug we used in the treatment of obesity, that you have the options: naltrexone, phentermine, then you have bupropion and liraglutide. So, in these four options, which is the drug which is contraindicated in history, the patient of history of MEN or thyroid? Okay, time up. So, what's the option? Liraglutide. And 13 of you have answered correctly. And there's a slight change. Yes, only in the third position. And each team's marks will come in your mobile. So, right. The last question in endocrinology, the 15th question in the quiz. What is Laron syndrome? Pituitary apoplexy, hypophysitis, growth hormone insensitivity, idiopathic growth hormone deficiency. Laron syndrome. Five seconds. 21. Okay. Time up. Okay. Anybody in the audience? I think only 3 seconds. Growth hormone. Yes. Our MC. She'll get the pen. Who? She'll get the pen. What's your name? Shravani will get the pen. For the right answer, the pen will be given by me. And see, the MC is asking me again. The rapidity of the answer is the one which decides the thing. That is known in this Kahoot. So please be, if you are very sure, please be fast in pressing the option. That finishes three sections of the quiz. We come to the fourth one, infectious diseases. Question number 16 on the screen for you. Which of the following is the secondary vector in the transmission of dengue virus? I think all of you should know this. Aedes pollensis and Anopheles gambia. Secondary vector. Secondary vector. 17. 20. Yes, any answers from the audience? Albopictus. Our interns are quite smart, but the pens will not be given again and again. So a lot of people have answered, I think. 6 only. Okay, fine. That's bad. Okay. Question number, yes. The first three are the same. So 17th question on the screen for you. Question number 2 in endocrine. Infectious diseases. The syndrome of Stapes dorsalis and meningovascular inflammation of the spinal cord are usually associated with which of the following illnesses? Syphilis, HIV, dengue, tuberculosis. Which of the following antimicrobials comes under the drug class of lincosamides? Lefamotine, chloramphenicol, clindamycin, and doxycycline. Lefamulin. 20. 21. Okay, anybody in the audience? Clindamycin. Good. So what's the position? 11 of you answered correctly. And yes. Slight change in third position. Has come up third position. We go to question number 19. Fourth question in infectious diseases. Which of the following organisms is the causative agent for the disease melioidosis? Burkholderia capacia, Burkholderia pseudomallei, Burkholderia malai, Stenotrophomonas maltophilia. I think this also is relatively easy. Let us see. Okay, 21. Anybody in the audience? Anybody in the audience? You're told, no? Time up. 5 seconds left. Anybody in the audience? Burkholderia, all 3 Burkholderias are there. So, pseudomallei. Burkholderia. So, 17 of you answered. Good. So, leaderboard. First 3 same. Now, question number 20. Question number 20. Fifth question in infectious diseases. Which of the following antifungal drugs acts by inhibiting beta-1 3-glucon synthase? You have a isoquinazole, you have a posaconazole, then you have flucytosine and caspofungin. So antifungal. 18. Network. I think you can check. Another team, huh? Okay. Network issue, I think whether to build the place, you have network issue now. Okay, that is 20 questions over. And what's the position? Same. We have finished 4 sections. We have finished the history of medicine, cardiology. We have finished this one, what is that? Infectious diseases, endocrine. What is that? Any problem? Before we go on. Molecular mimicry of the nervous system by which of the following organisms is believed to cause the development of GB syndrome? You have Clostridia perfringens, you have Acinetobacter, we have Campylobacter jejuni, we have Parabacteroides distassonis. So these are the 4 options. Again, so these are the 4 options in Thenwa. I think there's again. Okay, most of you answered correctly. Campylobacter jejuni. We are okay. Another 9 minutes. 19. 21. Okay. Anybody in the audience? Any try? So, the correct answer is no cancer association. And how many? 7 of you answered correctly. Shall we go to the leaderboard? Same. Okay. Now we have got the section on hematology. Question number 46. Last 5 questions. In an adult male weighing about 80 kilograms, what is the normal iron content in milligrams in his hemoglobin? 3000 mg, 2500 mg, 1700 mg, 1000 mg. So 11, 16, 20. Yes. Any guesses in the audience? So only one has answered correctly. So you should know it. It's the first option, 3000 mg. Okay, we go to question number 47. The second question in hematology. Leaderboard, same. Which of the following genes is essential? 1 minute. Which of the following genes is essential for hematopoiesis and erythroid differentiation? QTL, ZPT, B7A, BCL11A, MYB. So 13, 14, 15, 16, 17, 19. Anybody in the audience? No, sorry. Anybody else try? The time is not up yet. So MYB, and how many have answered correctly? 8 of you answered correctly. So question number 48. Third question in hematology. Which of the following diseases causes megaloblastic anemia due to lack of trypsin, which causes dietary cobalamin intrinsic factor deficiency, and also Okay. So in these options, which are the one? Gluten-induced enteropathy, severe chronic pancreatitis, tropical sprue, Imerslund Grasbeck syndrome. So there is a difficulty in binding of this one, and also there is a the calcium concentrate, calcium ions in the serum, in the ileum falls below the level which is necessary for, yes. So the answer is severe chronic, answer is the, yes, severe chronic pancreatitis. 6 of you have answered. It's a tough question. Anyway, that is question number 3. Now we come to question number 4, 49th question in hematology, the 49th question overall. Yes, the leaderboard, same, huh? Okay. Which of the following drugs carry a definite risk of precipitating hemolysis in G6PD deficient patients? You have methylene blue, you have quinine, you have amino salicylic acid, you have acetaminophen. So 20 have answered up to now. Yes, 21. Okay, anybody in the audience? Quinine is not the answer. Methylene blue. And how many answered correctly? Only 2. K. Segde Academy 1. 5th is Kanachur 4th. So that's the position. First 5 teams will get, of course, all the participants will get certificates. Don't worry. Because we have got only 21 teams and I have made certificates for 25 teams. Because that was usually the complaint by the HODs. My team, people go there, they don't get. So everybody will get certificates. All the participating teams. First 3 teams will get the trophy and the certificate. Of Kanachur Institute of Medical Sciences, Professor Dr. U.P. Ratnakar. The chairman of the Kanachur Health Sciences Advisory Council, Professor Dr. Muhammad Ismail. The member of Kanachur Health Sciences Academic Council, Professor Dr. M. Venkatray Prabhu. The medical superintendent of Kanachur Institute of Medical Sciences, Professor Dr. Harish Shetty. Distinguished staff members of the Kanachur Institute of Medical Sciences and participants, plus interns and postgraduates of the Kanachur Institute of Medical Sciences. I would like to warmly welcome the Dean of Kanachur Institute of Medical Sciences, Professor Dr. U.P. Ratnakar, who has been a source of inspiration for all the departments regarding academic activities. An academician par excellence. We welcome you, sir, to this prize distribution ceremony of the quiz. Professor Dr. Muhammad Ismail is a colossus. He is also very much into academics. He has been a source of inspiration for the Department of General Medicine in these quizzes and other teaching programs and the CME which we conduct every year. We would like to warmly welcome you, sir, to this prize distribution ceremony. Professor Dr. M. Venkatray Prabhu, former Pro Vice Chancellor of MAHE and presently the member of the Kanachur Health Sciences Advisory Council. You have been always a source of encouragement to us. Sir, I would like to warmly welcome you. And Professor Dr. Harish Shetty, the Medical Superintendent of Kanachur Institute of Medical Sciences. He has been behind all the activities of the Department of General Medicine. He has been supporting us very, very actively. We welcome you, sir. And as already I would like to welcome Dr. Satyamurthy Aital and other people of the various departments. Now, briefly, this KIMS PG Mediquiz is in the 3rd year of its inception. In the first year, it was won by KMC Mangalore, and in the second year, it was won by KMC. First year, it was won by KMC Manipal. The second year, it was won by KMC Mangalore, and this is the 3rd edition of the KIMS. It's a state-level quiz, of course, but local players usually participate. A Kahoot mobile app-based quiz, having about 50 questions, each question of 30 seconds, and you have gone through it. So at the very outset, I would like to thank the HODs of the different colleges, starting from KMC Manipal, Professor Dr. Raviraja Acharya, KMC Mangalore, Professor Dr. Satish Rao, K.S. Hegde Medical Academy, Professor Dr. Sudhindra Rao, of course, Kanachur, our own institution. Then we have Enapaya Medical College, Professor Dr. Mukhtar, KVG Sulya, Professor Dr. C.R. Bhatt, and Father Muller's Medical College, Professor Dr. Roshan. All these professors have been instrumental in sending. There were totally 21 teams participating. I hope I have not left anybody. Malya, have I left any other college? Because sometimes, when you're doing extempore, you forget. And we thank all the participating teams. Please continue encouraging us. And possibly in the years to come, it may be broad-based. Maybe the other colleges all over the state participate. I have been in touch with all the HODs many times, but no problem. Quite a few questions were tough, quite a few questions were easy. Now I don't take the credit for the questions. Usually I get it outsourced to some of my the colleagues, and there is Dr. Gerald James, who was here as SR and now he's in Kottayam. He's the one who he was formulated the question. So I would like to thank him in absentia. And also I would like to welcome the people who have helped us in the organization's event. There is Rotarian M. Vasanta Malya, who is a media person, and he'll cover this item very well. It will come in a lot of newspapers, and also it will come in the TV channel, local TV channel. There is Surendra Karkerav, who is a freelancing videographer, and this program will be broadcast in Spandana TV. Also, we have the IT department, which has helped us in the organization, and we had A1 Logics, owned by Rotarian Praveen Udupa, which is, as I told you, the #1 computer lab in the entire country. They have programs of 20,000, 30,000 people and all virtual conferences they organize. So Gautam from A1 Logics had come, and because of that we had some technical issues in between, but that was sorted out. The problem with this Kahoot mobile app based quizzes, you depend on connectivity. So many times we advise the participants to come with good mobiles. Now 5G has come already, and with good internet to some. Anyway, I hope you have enjoyed the experience, and I hope you have learned very much by the experience. We will keep on doing these kind of programs in the future also. I would like to thank my colleagues in the Department of Medicine for being with me, and then the postgraduates, entire team. There are 15 postgraduates in Kanachur, first and second year, and first and second, third batches. One of them was on leave, but all the others have participated. 7 teams have participated. The beauty of this Kahoot mobile app based quiz which I am organizing is we can accommodate up to 150 teams at a time. And the beauty of this Kahoot quiz is that all the teams get the equal opportunity. So there is no question of any round robin system where one team gets an advantage, other team does not. And the buzzer quiz which I was doing earlier, which also is fraught with problems. The Kahoot app-based quiz gives equal opportunities for all the teams. There is no negative marks. You can go on playing, like you can try guessing, and the rapidity of the answer usually decides on who is the. And earlier I was told it, but I would like to tell here also, in one of the quizzes which I was organizing, till question number 49, it was not a medicine quiz, it was a Rotary quiz, till question number 49, one person was nowhere in the picture. But the 50th question, he was the only one who answered. Suddenly he came on top. So that's the beauty of this quiz. Every question has got the value. And I mentioned it in the past also. Baron Coubertin, the founder of the modern Olympics, always used to tell that it is not winning which is important, it's participation. So the teams which don't please go back disappointed. You have participated very well. Every team will get the certificates and the recognition, and of course the results are known to all of you, and we'll have the prize distribution shortly, but before that we have a few more speeches. Thank you for your cooperation.
Good morning to all. Another edition of the quiz program, our own Kanachur version of Kaun Banega Karodpati. Of course, millionaire in knowledge only. Conducted by our own Amitabh Bachchan, Dr. Devdas Rai, comes to an end. And little more about the quizzes and my thoughts about the quizzes. Quizzes are usually used as evaluating tools, hardly ever used as a teaching or learning aid. However, I have come across a few papers recently which suggest that there may be a very strong link between quizzing and student success in the examination. When students are quizzed over class material at least once a week, they tend to perform better in midterm and final examinations compared to students who never took the quizzes. Use of frequent quizzing as a learning and teaching tool reduced failure rate. Actually, some of the studies show that odds of passing went through the roof where teachers used quizzing as a teaching tool. However, these results require more substantiation. These are all very small studies. You require bigger sample size, and of course, randomization have not been done so far. Anyway, these results can be food for thought. Even if quizzes only modestly impact students' ability to perform well in the examination, we should think of using quizzes as a tool in our teaching curriculum. However, one word of caution, MCQ seems to be less effective than constructive response questions, where the students have come up with their own answers from memory, not choosing 1 out of 4, instead of choosing the right answer in the MCQ. So MCQ per se may not be that effective. With these words, I would like to conclude and compliment Department of General Medicine and Dr. Devdas Rai for conducting this very popular quiz competition. Jai Hind and thank you.
And it's a very pleasurable moment to be here to learn what the quiz did to us. And in fact, when I entered, I felt the questions were very, very easy, only answers were very difficult. So if I were to take part, I think I would have got the first prize and the last. Quiz is the one which actually is very entertaining, educative, and it is really provokes you to learn more and more. And the quiz started, I think, somewhere in 1780s. The first quiz took place in the world is around 1780s. The biggest quiz, the world record for the quiz. Any answer? I'm quizzing you. The biggest quiz in the world took place in 2010 in Belgium. 2,780 participants were there. So in fact, quiz is the one which really gives us a lot of strength, encouragement, education and academic exercise. And here, all of you participated. I am very happy that a lot of the colleges have come. My former college also has come. And you have taken part and you have got the prizes. And whoever has won means that you are very excellent. And whoever did not win also are more excellent. You have got more chances to learn more. Thank you very much. All the best.
Dr. M.V. Prabhu sir to give away the 5th prize. The 5th prize goes to Dr. Snehal and Dr. Rana from Kanachur Institute of Medical Sciences. Be a success without them. I also acknowledge the hard work of our interns for their dedication in making this competition a success, and gratitude to all the participants for their enthusiasm and making this event truly engaging. I also thank Dr. Jaril. Lastly, I would like to thank the audience for their presence and encouragement. Thank you all for being a part of this memorable event.